I give the call to the honourable member for Werriwa.
Thank you, Mr Speaker. As we enter February, the holiday season is well and truly over. Schools resumed, university is about to start, and life, with all its busyness and daily routines, is in full swing. A regular aspect of our daily routine, Speaker, is that we should make sure our health is taken care of. Thankfully, in Australia, we have Medicare. Uniquely Australian, Medicare celebrates its 40th birthday this month. Proudly a Labor initiative, Medicare means that everyone has equal and fair access to the best healthcare system in the world. Often we read about healthcare systems, we focus on the acute side of care, that is, our hospitals and emergency departments. And while they are important and vital, it is, of course, best not to end up in there in the first place. Prevention and early detection are surely the key to stay out of hospital. In truthfulness, in the past few years, life has been anything but normal. It's been disjointed and fractured. As a result, many haven't kept up to date with their regular checkups at their GPs or specialists. Sadly, the flow-on effect of this will be enduring long after the COVID pandemic. With the crisis of the pandemic receding, there's no longer any excuse to put off those regular checkups. The announcement this week of the cancer diagnosis for King Charles shows that everyone is at risk. I wish the King a speedy recovery to good health. I know that often we are afraid to do those preventative tests lest we get a result that changes the course of our lives or those of our loved ones. They are normal and understandable fears, but ignorance in these matters is not bliss. We have a responsibility to ourselves and families to take care of our health and ensure we do our screening tests. Our lives can often depend on it. A common screening test that Australians are familiar with is the one for bowel cancer. We know that 90% of cases, if found early, can successfully be treated. Australians between 50 and 74 receive a screening test kit every 2 years. It's a simple, easy test to complete and it can save your life. And whilst participation rate has increased since 2014, that number has decreased in the past few years and is sitting around 40%, nowhere near high enough. Similarly, women across Australia between the ages of 50 and 74 receive a letter every 2 years to participate in a free mammogram to help detect breast cancer early. 1 in 7 women in Australia will develop breast cancer in their life, and the earlier this is found, the easier it is to treat. But early detection relies on screenings. Recently, Speaker, I had my own regular mammogram, and I'd like to thank Vicky and Juliana, the 2 wonderful staff at Breast Screen Liverpool, who took care of me when I was called back for further screening. It can be an uncomfortable and sometimes awkward test, but amazing professionals like Vicky and Juliana around Australia make it easier for all of us. Women should also participate in cervical screening tests. And whilst the rates of participation there are relatively high at 68%, we can do more to increase these numbers. And let's not forget Australia, the lifestyle and its lifestyle of sport, beach and sun leaves us exposed to skin damage. Every 30 minutes in Australia, someone is diagnosed with melanoma. Thankfully, 99% of skin cancers are curable, but they need to be detected early. And the simplest and most effective method is to get a regular skin check at your GP or skin clinic. Bowel, breast, cervical, skin cancer or melanoma. They devastate far too many lives. But all of these cancers can be successfully treated with early detection. For each of these cancers, there are 4 simple, yes, incredibly effective screening tests available to all Australians. And as Australians, we need to be there for our families and our loved ones, so please make sure that you get them. After the horrors of the past few years, let us do our bit and make 2024 the year of health screening, making sure that your vaccinations are up to date and protective health in general. Surely that is the best New Year's resolution of all.
Well said by the member for Werriwa.